Hi everyone, my name is Candace Abergnani and I'm going to be talking about the topic of universal healthcare. The United States has always had a flirtatious relationship with universal healthcare, and it's been a debate in history for most of the 20th century. As healthcare costs continue to rise, accessibility continues to erode, and the unprecedented times of COVID-19 pandemic, everyone is beginning to discuss the healthcare reform. The demand for insurance is exactly like the demand for products and services in everyday life and depends on consumers' ability and willingness to pay for it. Before we go into the topic of universal healthcare, I'm going to mention a few facts of the current state of our healthcare system currently in the United States. We pay twice as much per person on total healthcare spendings and prescription drugs than any other developed country. This healthcare spending nearly makes up 18% of our gross domestic product in the United States. The U.S. ranks at near the bottom in health indicators such as infant mortality, life expectancy, and preventable mortality rates. An estimate of over 88 million people between the ages of 19 and 64 were inadequately insured in 2019. Healthcare costs continue to rise exponentially, and the quality of care is far from ideal. And according to the American Journal of Public Health, health expenses drove Americans into bankruptcy more than any other reason. There are four major types of national healthcare models, and we'll take a look into each one. The first model that I'm going to discuss is also known as the Beveridge model. The government acts as a single payer, removing all competition in the market to keep costs low and standardize benefits. As a single payer, the National Health Service controls what in-network providers can do and what they can charge. Funded by taxes, there are no out-of-pocket fees for patients or any cost sharing. Everyone who is a tax-paying citizen is guaranteed the same access to care, and nobody will ever receive a medical bill. The Bismarck model is a model that doesn't provide universal health coverage. It requires employment for health insurance, so it awards its resources to those who contribute financially. Employers and employees are responsible for funding their health insurance system through sickness funds created by payroll deductions. The private insurance plans cover every employed person regardless of pre-existing conditions, and the plans are non-profit based. The next model that I'm going to be discussing is actually a model that was recently adopted by Taiwan, and it is known as the National Health Insurance Model. It blends different aspects of both the Beveridge model and the Bismarck model as previously discussed. The government acts as a single payer for medical procedures, and it is a model driven by private providers, but the payments come from the government-run insurance program that every citizen pays into. The out-of-pocket method is the most common model in less developed areas and countries where there aren't enough financial resources to create a medical system. Patients must pay for the procedures out of pocket, and healthcare is driven by the income. The primary question every country faces when it comes to choosing a universal healthcare form is establishing the needs and wants of society as a whole. The universal healthcare model that I would like to be implemented within the United States would be the National Health Insurance Model. The reasoning for my proposition is because it is a single payer framework, which is key to reining in the relentless healthcare costs, providing universal healthcare coverage. Publicly financed, single-payer universal health care provides the largest administrative and bureaucratic savings by eliminating private insurers. The second largest source of saving comes from the reduced cost of prescription drugs by using the federal government as a negotiating leverage to bring down prices. The single-payer system provides comprehensive information to create provider profiles to reduce potential fraudulent claims, abuses in codings, and the overuse of tests. Cost containment under national health insurance system often relies on single source funding. When physicians and hospital administrators know that there is a certain amount of resources at their disposal and that no more will be anticipated, they'll figure out ways to perform the job with what they have. It is important to note the amount that can be saved by reducing physicians' incomes. U.S. physicians' net incomes account for about 10% of all healthcare spending. If these incomes were reduced by 20%, the savings would be 2% of healthcare spending. Drug prices in the United States usually contain significant monopolies, as evidenced by willingness of drug manufacturers to sell identical products overseas at much lower prices. Implementing this national health insurance model will help decrease the prices of these prescription drugs and eliminate those monopolies. It contains minimal administrative and billing costs on providers and payers. The insurance plans are inexpensive to run because everyone in society must join, and premiums are collected through the tax system. There are quite a few benefits when it comes to implementing this new healthcare reform, and they include having a right to healthcare could potentially improve public health. According to the study in Lancet that looked at data from over 100 countries, evidence suggests that broader health coverage generally leads to better access to necessary care and improved population health, particularly for poor people. Providing healthcare to all citizens is good for economic productivity. Institute of Medicine reported the U.S. economy loses $65 to $130 billion annually as a result to diminished worker productivity. So anyone who calls out sick for about 3 to 4 days due to being uninsured or having poor health and premature deaths all lead to these billions of dollars being lost. The World Bank President Jim Young Kim stated that all nations should provide a right to health care to help foster economic growth. The right to health care could save lives. A study from Harvard Research found a lack of health insurance is associated with as many as 44,789 deaths per year, which translates into a 40% increased risk of death among the uninsured. Right to health care could decrease the cost of health care in the United States. According to the study of the University of Massachusetts at Amherst, under a single-payer system in which all citizens are guaranteed a right to health care, total public and private healthcare spending could be lowered by up to $1.8 trillion over the next 10 years due to lowered administrative and prescription drug costs. Now here comes the ugly truth. When it comes to everything in life, there's going to be advantages and disadvantages, including universal healthcare reform. We'll take a further look at the disadvantages and the objections that people may have when it comes to implementing universal healthcare in the United States. It is important to note that there is no perfect plan when it comes to universal healthcare. Universal coverage does not eliminate or even substantially reduce differentials across socioeconomic groups. In England, there was a study performed regarding infant mortality in the lowest socioeconomic class is double the rate of the highest class, even with the prior introduction of national health insurance. Life expectancy varies depending on a person's healthy lifestyle choices and occupations. It's a choice to be healthy or unhealthy. In 1974 book, Who Shall Live, Fuchs wrote a quote that I thought was very intelligent, and he stated, "Today, differences in health levels between the United States and other developed countries or among populations in the United States are not primarily related to differences in quantity or quality of medical care. Rather, they are attributable to genetic and environmental factors and to personal behavior. Indeed, except for the very poor, higher income often seems to do as much harm as good to health, so that differences in diet, smoking, exercise, automobile driving, and other manifestations of lifestyle have emerged as the major determinants of health." Basically, what he is stating is that it is all dependent on the person to be healthy. The lifestyle is the predominant determinants of health, and it's not the healthcare, unfortunately. Cost is another big factor when it comes to universal healthcare. It's not a matter of raising new money, but rather reducing total healthcare costs and distributing payment more equitably and efficiently. It's a hard pill to swallow, knowing you could potentially be paying for someone else's healthcare who simply does not want to take the responsibility of taking care of themselves and choosing to live a healthy lifestyle. America is prided on freedom of choice with the emphasis on individual opportunity and achievement prevailing most of the time. This is basically what America was built on, is to be free and to have the right to choose. And when universal healthcare comes into play, it essentially removes that right to choose if you'd like healthcare insurance or not. Government is the problem, not the solution. This is a very common quote that we've seen amongst the United States. America's distrust in government is substantial and prohibits the expansion of government, which in return will push back any healthcare reform from happening that is ran by the government. And lastly, unlike other countries, the United States population is one giant melting pot with multicultural people sharing different beliefs, religions, languages, traditions, which results in a lack of identity and empathy for one another. Unlike other countries like Japan, Europe, or Taiwan, they all have a sense of national identity and tend to want to care for each other a little bit more than the United States, since we are multicultural and just have different views of life and traditions and how it is. So regarding my stance when it comes to universal healthcare, I take a philosophical and egalitarian approach. There's two people who really caught my attention and their ideals and their thoughts when it comes to universal healthcare and just that idea of healthcare in general. The first person is named John Rawls, and he wrote A Theory of Justice, and it basically appeals to one sense of justice or collective responsibility and restraining against making a choice from a veil of ignorance. Some individuals are born into unforgiving lives. No one knows if they're going to be born into a rich or poor, healthy or sick family. We must give everyone an equal opportunity to have access to healthcare. Justice and fairness must prevail in society. The second person who I really looked up to regarding their thoughts on healthcare is a professor of health policy and geriatrics at Mount Sinai School of Medicine in New York, and he is named Bruce Fledek. He argues that curing disease and improving functional outcomes are not the only benefits of medical care. We expect the health system to take care of the sick people, whether or not they're going to get better, as much for our benefit as is there. The care provided by health professionals have value even when they are not changing the outcome of the patients. One way that I think that the United States could integrate universal healthcare reform would be slowly integrating universal healthcare and small focal points such as focusing on communicable diseases that impact the society as a whole. It is in the nation's best interest to prevent the spread and transmission of these communicable diseases and separate and treat the ill. This will help increase the positives for the society as a whole who are paying for the healthcare costs through the tax system. And by focusing on specific aspects of universal care, it will help identify the agreements and disagreements within the society and increase the odds of coming to a mutual agreement and begin the formation and development of a healthcare reform and adaptation of universal healthcare in the United States. I wanted to thank everyone who is watching this video. I hoped everyone gained valuable information and a little insight on the topic of universal healthcare. Being in the study of healthcare and pursuing a career in it, I feel it is very important to take care of others and always pursue health within myself and society as a whole. The gravity of COVID-19 pandemic has made the subject of healthcare extremely relevant in today's day and age, and after all, we're all in this together. So thank you so much for listening. I hope everyone is happy and healthy and everyone takes care.